If you understood part 1 of our arterial blood gas, congratulations. That shows that you are able to identify respiratory and metabolic disorders. Now, let us take you one step further. How do you know whether the body is trying to correct the imbalance? That is called compensation. So compensation simply means that the lungs or the kidneys are trying to move the pH back towards the normal range. And here is a simple or key rule. If the lungs caused the problems, the kidneys will try to compensate. If the metabolic system caused the problem, then the lungs will try to compensate. The CO2, think respiratory, think lungs. There are 3 levels of compensation that you need to know: the uncompensated, the partially compensated, and the fully compensated. The easiest way to identify them is by looking at what the pH, the CO2, or the bicarbonate are doing. So let's head back to the whiteboard and let us break it down step by step. So before I take you on the examples of or types of compensation, let me explain the expected finding. For uncompensated, you will find out that the pH is always abnormal. One of the CO2 or the bicarbonate will be abnormal as well. The other value will be normal. So for uncompensated, pH will be abnormal. Either of the CO2 or the bicarbonate will be abnormal. For partially compensated, the pH will be abnormal and both the CO2 and the bicarbonate will be abnormal. For fully compensated, that means the pH is normal, but both the CO2 and the bicarbonate are abnormal. Let's take practice examples. Now that we've learned the 3 types of compensation, let's practice together. So the first one, our pH is 7.30. That is below the normal range. And this patient is acidotic. Now look at the CO2. The CO2 is 50, which is high. The bicarbonate is 24, which is within the normal range. So that means the kidneys haven't started to compensate yet. So this is uncompensated respiratory acidosis. So let's look at example number 2. This patient is still acidotic. The pH is 7.32. The CO2 is 50. So the primary disorder is respiratory acidosis. Note that they are going in opposite direction. The bicarbonate is still high. Why is this high? This bicarbonate is actually high because the kidneys are trying to help by retaining bicarb, which is a base. The pH, even though still abnormal, so the body has not corrected this imbalance. Therefore, this is partially compensated respiratory acidosis. Let's move on to example number 3. In example number 3, pH is 7.50, which is high. The patient is alkalotic. The CO2 is normal. The normal CO2 is 35 to 45, so the CO2 is normal. The bicarbonate is 30, which is elevated. So the pH and the bicarbonate are moving in the same direction. This is metabolic alkalosis. Because the lungs have not changed the CO2 yet, there is no respiratory compensation. This is uncompensated metabolic alkalosis. Now let us move over to example number 4. The last example is the one that usually confuses students because the pH is 7.36. At first glance, you might think that everything is normal, but don't stop there. Whenever the pH is normal, use 7.40 as your guide. Since 7.36 is below 7.40, the pH is still leaning towards acidosis. Now let's take a look at the bicarbonate. The bicarbonate is 18, which is low. Now look at the CO2. The CO2 is 30, which is low. The lungs have fully blown off the carbon dioxide to help raise the pH. The pH is now back in the normal range, but the CO2 and the bicarbonate, they are still abnormal. This tells us that this is fully compensated. So fully compensated metabolic acidosis. Let's summarize. I know this is a lot, but Take it slowly and you will understand. Abnormal pH, one system is abnormal, the other system is normal. That's uncompensated. If this helped you, please like this video, share, and follow for more. I will see you again. Happy studying, future nurses.